so beautiful. I hope he takes good care of you. But am I taking good care of you now against threats like cervical cancer?
Mama!
Choose vaccination for daughters to safeguard their future.
Cervical cancer is a significant health concern for women worldwide. At Jarurat Foundation, we are dedicated towards offering comprehensive support and information to those affected by this disease. This video provides an in-depth understanding of cervical cancer, including recognizing symptoms, exploring treatment options, and managing life with the disease. For more information, please visit www.jaruratcare.com. I'm your speaker, Savik Chai, taking you on this journey to be a more informed citizen. Recognizing symptoms of cervical cancer. When symptoms first appear, cervical cancer often develops slowly and early stages may not present noticeable symptoms. However, as the disease progresses, certain signs such as unusual vaginal bleeding, pelvic pain, or discomfort during intercourse may become evident. The symptoms of cervical cancer can be grouped into two categories, which is common symptoms and other symptoms. Let us first look at the common symptoms, which includes unusual vaginal bleeding. This may occur between periods, after intercourse, or post-menopause. Second is pelvic pain, persistent pain in the pelvic region that is not related to menstrual cycle. Discomfort during intercourse, pain or discomfort during sexual activity. Unusual vaginal discharge, discharge that may be watery, pink, or foul smelling. Charges in menstrual cycle, irregularities in the timing or heaviness of periods. Now let us look at the other symptoms, which includes lower back pain, pain that can extend into the legs, unexplained weight loss, a sudden loss of weight without any changes in the diet or exercise, fatigue, constant tiredness or lack of energy, swelling in legs, often caused by a tumor blocking blood flow. Now, let us look at the diagnostic test. Detecting cervical cancer involves several tests to confirm the presence and the stage of the disease, which include pap smear, a screening test to detect the precancerous or cancerous cells in the cervix, HPV test, detect the presence of the human papillomavirus, a major cause of cervical cancer, colposcopy, a procedure using a special microscope to examine the cervix for abnormal cells, biopsy, collection of tissue samples from the cervix for detailed examination, and also imaging tests which include CT scans, MRI, or PET scans to assess the spread of cancer. Stages of cervical cancer. Cervical cancer is categorized into stages of 0 to 4. At stage 0, abnormal cells are present but have not spread beyond the surface of the cervix. Stage 1, cancer is confined to the cervix. Stage 2, cancer has spread beyond the cervix in nearby tissues but not to the pelvic wall or lower part of the vagina. At stage 3, cancer has spread to the lower part of the vagina, pelvic wall, or nearby lymph nodes. In stage 4, cancer has spread to the distant organs such as the bladder, rectum, or beyond. Now, let us look at what are the treatment options we have. Number 1 is surgery. Removal of the cervix, uterus, or the surrounding tissues depending on the stage. Second is radiation therapy. High energy radiation to kill cancer cells, often used in combination with chemotherapy. Chemotherapy, systemic drug to destroy cancer cells, often used in advanced stages. Targeted therapy, drug that specifically target cancer cells, limiting damage to the normal cells. Immunotherapy, boosts the body's immune system to fight cancer cells. Managing daily life with cervical cancer. Daily routine and lifestyle. Managing cervical cancer involves adapting to changes in daily life, including managing symptoms and side effects. Maintaining a balanced diet, regular exercise, and mental health are crucial. Work and activities. The ability to work or engage in usual activities may be impacted by treatment. Adjustments such as flexible work hours or temporary leave may be necessary. Mental health. A cervical cancer diagnosis can be emotionally challenging. Support from mental health professionals, counselors, and support groups can help manage stress and anxiety and depression. Support systems. Family, friends, and support groups play a vital role in providing emotional and practical support. Open communication is essential to ensure that patient needs are met. Even if life is tough, I would say smile. Smile because life is too short to be unhappy. Cherish the moments that you still have. Spend time with your family and friends. Do the things that you have kept aside in your bucket list and make these very moments memorable. Nutritional and lifestyle consideration. Role of nutritionists and dietitians. Nutritionists and dietitians can help manage dietary needs, address nutritional deficiencies, and create meal plans that accommodate treatment side effects and support overall health. Dietary restrictions. Dietary changes may be necessary to manage symptoms such as nausea, vomiting, and digestive issues. Focus on nutrient rich, especially digestible foods to maintain strength and health. Lifestyle changes. Incorporating light physical work as advised by the healthcare professionals can improve well-being, reduce fatigue, and enhance mood. Financial and practical concerns. Financial challenges. Cervical cancer treatment can be expensive with cost for medical treatment, medication, and potential income loss. Understanding and managing these financial aspects is crucial. Insurance assistance. Patients should explore health insurance coverage, financial aid programs, and assistance with medical bills to ease their financial burden of healthcare. Transportation and additional resources. Assistance with transportation to medical appointments may be needed. This can be arranged through family, friends, or community services. Additional resources may include home care and practical support programs. Prognosis and career goals. Prognosis information. Prognosis provides insight into the likely course of the disease, potential outcome, and survival rates based on the stage, type, and treatment response. Understanding the prognosis is vital for making informed career goals. Setting goals for treatment. Patients should set personalized goals for managing symptoms, improving quality of life, and maintaining functionality. These goals should align with the individual needs and preference. Advanced career planning. Advanced career planning involves discussing and documenting preference for future medical care, including end of life decision. It is essential to communicate these plans with the healthcare providers to ensure they align with their personal wishes. Communication and information. Access to information is crucial. Patients should have comprehensive information about the diagnostics, treatment options, and prognosis. Effective communication with healthcare provider is key to understanding and managing the disease. Quality of communication. Quality communication is vital for ensuring the healthcare providers listen to the patient concern, explain medical information clearly, and involve patients in decision making. Patients should feel comfortable asking questions and seeking clarification. Asking question is important, but asking the right question is crucial. Patients should inquire about the type, age, and stages of cancer, available treatment options, potential side effects, and expected outcome. Understanding this factor aids in making informed decisions. Emotional and psychological aspect is crucial in every cancer patient's life. Coping with emotional distress. Managing emotional distress involves seeking support from counselors or support groups, practicing relaxation techniques, and maintaining social connections. Engaging in hobbies and activities can also help. Support resources. Counseling, support groups, and mental health services are valuable for managing stress, anxiety, and depression. Finding the right resources can enhance emotional well being. Fears and concerns. Common fears include disease progression, treatment side effect, and the impact on the personal and family life. Addressing these concerns with healthcare providers can offer guidance and reassurance. Research and experimental treatments. There is always something new happening in the field of science and medicine. Clinical trials and experimental treatments. Patients should be informed about clinical trials, including the purpose and potential risks and benefits and how they compare to standard treatments. Exploring new treatment options can be an important part of the care. Benefits and risk. Discussing the potential benefits and risks of experimental treatments helps in making informed decisions. Understanding how these treatments fit in the overall care plan is crucial. I would say have patience. Even miracles take time. A caregiver is more like a best friend to a cancer patient, someone who is ready to help whenever their friend needs it. Understanding the caregiver's role. Caregivers play a crucial role in managing daily tasks, providing emotional support, and navigating the healthcare system. The involvement may vary in duration and complexity based on the patient's needs. Challenges and needs. Common challenges include managing medical needs, dealing with emotional stress, and balancing caregiving with personal responsibilities. Support and resources are available to help caregivers cope with these challenges. Emotional impact. Caregiving can lead to stress, burnout, and emotional strain. Caregivers should seek support from counseling, support groups, and practice self care to manage these impacts effectively. Support and resources. Support for caregivers include financial assistance, respite, care services, and educational resources. Caregivers should explore available resources to enhance their ability to provide care. To all the caregivers who have never left their friend's hand, I would say the simple act of caring is heroic. Conclusion. Cervical cancer presents significant challenges, but with right information, support, and resources, patients and caregivers navigate this journey more effectively. At Zarurat Care Foundation, we are committed towards providing comprehensive support and guidance to those affected by cervical cancer. For more information, please visit our website www.zaruratcare.com. Thank you for watching this video. Your attention has been crucial. If you think this video has helped you in being a more informed citizen, please visit our website www.zaruratcare.com and make a small contribution. Your contribution will help us in serving more cancer patients in the future because we believe in the motto Jaisi Zarurat, Waisi Care.